Hello guys, and welcome to my channel. I basically make videos surrounded by my teen pregnancy. I am currently 18 years old. I've been posting videos around my teen pregnancy, and I would like to venture out, I guess. I wanted to fill you guys in on my 38-week appointment because I just had it today. Today is January 4th, 2021. So if you watched my 37-week video, if you didn't, I'll just give you a recap. But if you watched it, you know that I said that my doctor was watching me for preeclampsia, which is bad for the baby. It's hard on the mom and the baby, and it has to do with swelling, which is like water retention, high blood pressure, and anything like that. So, and they told me last Monday, a week from today, they told me that they thought I was getting preeclampsia because I had protein in my urine, I was swelling, and I had gained a lot more weight than I had my whole pregnancy because I have lost weight this entire pregnancy. I haven't gained any weight this pregnancy. I had only lost weight, and then at the end, I just gained like 10 pounds, which was not normal. I was expecting to go in there and them tell me I had preeclampsia and do something about it. My appointment was at 5 p.m. today, so that's why I didn't vlog it, because it was so late. There were only like 5 people in the waiting room left to be seen before me. Whenever I went in today, I signed in, or I didn't sign in because I checked in because I was the last appointment of the day. I checked in with the receptionist. She asked me how many weeks I was, asked me some insurance questions that I had to answer because my insurance has been messed up. I finally got it fixed though, so that's good. And then she gave me the cup to pee in, asked me how many weeks I was, put it in the computer. I'm 38 weeks, so she put that in the computer because I was expecting there to be protein in my urine because there was last week. I waited in the waiting room for a while. I got called back after about 30 minutes, I want to say, to only get my vitals checked because all the rooms are full, because where it was in the evening, they were trying to get everybody in and out as fast as they could. So I went ahead and went and got my vitals checked. My weight, I hadn't went up really any weight. I had gained 2 pounds, but they said that was kind of normal. And my blood pressure was a little bit high today, which I've not really ever had high blood pressure with the doctor. I haven't really had high blood pressure before, like during this pregnancy, so I wasn't expecting to have high blood pressure, so that kind of threw me off a little bit. And then they took my blood pressure, and the nurse goes, well, you know, it's a little bit high, but it's not like. I went back out to the waiting room until my room was ready to be called in. I got called in about 30 minutes later, so I was there for probably about an hour and a half tops, and I got called in about 30 minutes later, and I got to see my doctor. They told me to strip waist down, which is why they check you for dilation and everything. A med student came in first to check my baby's heartbeat. My baby's heartbeat was 146 today. Like I said in my last video, it stays between 130 and 150 all the time. And he checked my baby's heart rate, like I just said, and then he asked me a couple questions, and I answered him. And the only thing that I really had was contractions, which was helping me dilate, because I'll get to that in a minute. And he also asked me if I had any other issues that I was concerned about, and I just told him that I had been swelling some in my legs, which is around my ankle area, and my feet. And he said, you know, that's normal with pregnancy, but he goes, I'm going to check, and then I'll tell your doctor. So he checked my feet, and whenever he checked my feet and my legs, he said that they were swollen around the ankles. So he went up there and he told my doctor, we went over all that. So my doctor got called out on a delivery in the middle of my appointment, so I ended up seeing his assistant. So his assistant came in, which I've seen her before. She's so nice. She's the one that checked me today, and I'm just thankful it's either her doctor or my doctor that checks me, because I'm very comfortable with both of them. They have helped, like, they try to make all their patients feel comfortable, which I'm very thankful for, because they definitely make me comfortable. And so his assistant seen me today, and it's a woman. She's really nice. She checked me first. She said I was 2 centimeters dilated this time, and last week I was only 1 centimeter dilated. She said this week I was 2 centimeters dilated, but my cervix was still only 50% thinned, which is what it was last week. So my cervix hadn't thinned any, but it had dilated, if that makes sense. After we talked about that, she told me I was 2 centimeters dilated. She goes, there's some stuff we need to talk about. I said that because, I mean, I obviously knew. I figured it was the preeclampsia stuff because he had mentioned preeclampsia last time. And she looked at me and she goes, I don't think you have preeclampsia. But she goes, I think you might get there if we let you go any longer. Your blood pressure was high today. And she said last week you had protein in your urine. She said this week you don't have protein in your urine, but your blood pressure is higher than normal. And she goes, it's not high to where we're concerned about it. And she goes, we want to try to keep you that way for birth. Want to let me continue on with this pregnancy if I'm going to end up having severe toxemia in the end of it. She goes, we are going to start the induction process. She goes, I don't think you need to start tonight. She goes, if I was concerned that you weren't going to be fine, she goes, I would go ahead and put you in tonight and tell you you're going to have a baby tomorrow. But she said, your case is not severe yet. She said it's a very mild case, and she said we're going to try to keep it that way. So she said, I'm going to call the hospital and ask them when they want you to come in. She goes, so this week you will have a baby. So this week we are having a baby. So she told me that, and then she said, I'm going to go call the baby unit, and she said, I'm going to let you get dressed, and then after you get dressed, I'm going to come back in here, and then we will discuss the induction process. She came back in after a few minutes, and she said, okay. She goes, the hospital said that we can put you in on Wednesday night at 6 p.m. and you should have a baby here sometime Thursday. She sat down, she went through the induction process and how we would do that. She goes, on Wednesday at 6 p.m. you're going to come into the hospital. She goes, we're going to check you in. She said you will be admitted into your delivery room, and she said in there we will start your fluids, which is IVs obviously, and we will use a little pill and shove it up in there to soften your cervix, because my cervix is not completely softened yet. And she goes, we'll do that on after you get admitted on 6 p.m. Wednesday night. And then she said on Thursday at 7 a.m. she said 7 a.m. is whenever your doctor's in. Her and my doctor come in both at 7 a.m. that morning. She goes, we'll come in at 7 that morning. She said we will she goes, your doctor will break your water, and then we will start the Pitocin to get your contractions going, like really going, because my contractions are 2 hours apart every time I have them. They told me that I should have a baby sometime Thursday, because they're going to let me try to have a vaginal birth. My doctor told me last week that he can't promise a vaginal birth, but he said everything looks good to be able to have a vaginal birth. So he said unless an emergency happens, we will have a vaginal birth, which is what I'm planning on doing. I will go into that after I have her and everything. So we'll have a baby here Thursday. Like, it's crazy. Whenever you guys see this, she will already be here. That's how crazy it is. Because I plan to vlog a little video for Kesley to watch whenever she gets older, just because. And any video I make, even though I won't be pregnant anymore, will definitely still be under the KJM series, because that's just who she is. That's hers. So any video that has to do with teen pregnancy or anything will definitely be under there. Doctor's assistant did tell me to make sure I eat a really good meal before I check into the hospital. She said because you won't be allowed to eat anything after you check in until after you have your kid. So I was like, okay, that's fine. They are putting me in the hospital on Wednesday at 6 p.m. due to, she called it late term pregnancy hypertension, which is basically the first step of preeclampsia. I just want to fill you guys in on what happened and the fact that we'll have a baby whenever you see this. Thank you guys so much for watching. I will see you guys next time, and bye.